Hi friends, Namaskar. I'm Dr.Mukhmohit, your community medicine faculty, and a very warm welcome to this short review session on updates on tuberculosis preventive therapy, that is TPT, in India. So now the background of this game is that beta in year 2021 under the National TB Elimination Program, they gave us the recommendations or the guidelines on the programmatic management of tuberculosis preventive therapy, that is TPT, tuberculosis preventive therapy. So these guidelines were issued in year 2021 under the NTEP National TB Elimination Program, Ministry of Health and Family Welfare. Now, very recently in year 2019, there was a research which was conducted by Swindles S. Ramachandri R. et al. And this research was 1 month of rifampicin plus isoniazid to prevent HIV-related tuberculosis, which showed a promising result on 1 month of rifampicin plus isoniazid, and it showed that they were not inferior. It was a non-inferiority trial, and it showed that this drug combination was not inferior to the 6 to 9 months of isoniazid alone. So this was published in New England Journal of Medicine, and this was the basis of this very recent office order where the government of India has revised the guidance on tuberculosis preventive therapy for persons living with HIV, PLHIV, person living with HIV under NACP. This guideline has been given by National AIDS Control Organization to all the SACs, that is State AIDS Control Societies, and so on. So let us just have a very quick review about what is the TPT, current TPT, and what is the new update. We already know that the current TPT, that is the tuberculosis preventive therapy, we were already using these two regimes, 6 months of isoniazid or 3 months of H&P. P stands for rifampicin. So H is isoniazid and P is rifampicin. So we already know that 6 months of isoniazid was a standard TPT, TB preventive therapy, which was given in all cases whoever were eligible for TPT. The 6 months of isoniazid was given as daily treatment, daily tablets, and it was given in 180 doses of isoniazid alone. 3 months of H&P, it was given as weekly doses, and in 3 months total there will be 12 doses. That's all. This was the 3 months of H&P. We already know that in cases of drug-resistant tuberculosis, we were giving 4 months of rifampicin alone, 4 months of rifampicin alone, and this was given in cases of rifampicin sensitive cases, contacts of the rifampicin sensitive drug resistant tuberculosis, and in cases of contacts of rifampicin resistant cases but who were fluoroquinolone sensitive. So in cases of rifampicin resistance contacts, we were giving them 6 months of levofloxacin. There was another regime which was actually a non-priority regime. It was launched only in the state of Kerala, that is the 3 months of H&R. So it was not given too much priority in a country like India because we want to safeguard our rifampicin drug. Now there is this new regime, that is 1 month of H&P, that was published under this article, 1 month of rifampicin plus isoniazid to TB prevention, for TB prevention in HIV cases. Now this 1 month of H&P has been recommended by Government of India under this new office order dated 20th of May, and this 1 month of H&P, this is given as daily tablets, and it has to be given for 28 days, that is 1 month, in 28 doses. This is daily tablets in which the isoniazid is to be given at the rate of 300 milligram and the rifampicin is given at the rate of 600 milligram. It is independent of the age, it is independent of the weight category. It has been recommended to all children, all persons whose age is more than 13 years. So that is what is the new recommendation. This is beta what you need to remember as the new recommendation by the Government of India. So you already know that who were the people who were getting HIV, this TPT in PLHIVs. So we were giving in PLHIVs, that is the person living with HIV, all adults, children living with HIV in contacts with TB cases, or children who were age less than 5 years. In all these 3 cases, beta, we were already giving them, everybody will get TPT after ruling out tuberculosis. That is very important. So after you rule out tuberculosis, you were supposed to give TPT in all these cases. All person living with HIV, children living with HIV and less than 5 years. How will you rule out tuberculosis? The investigation they were using was CB-NAT. CB-NAT was the investigation of choice. Now in people whose age is more than 5 years, age more than 5 years, household contacts of TB cases, or other high risk groups who could be getting tuberculosis, like patients on immunosuppressive therapies, long term steroid silicosis, dialysis patient, transplant surgeries. In all these cases, beta, we are supposed to give TPT because TB is most common opportunistic infection. You're supposed to give TPT. But first, before giving TPT, you will do TBI, tuberculosis infection testing. You will check them for the TB infection. So TB infection will be there or may not be there. How do you check for TB infection? That is what is the latent TB now. You check for latent tuberculosis. You check for latent tuberculosis. Latent tuberculosis, positive or negative? If the latent tuberculosis is positive, that is the patient already had TB infection, these are the only people who may be developing TB infection, active TB later on in life now, because to have active TB, you need to have a latent TB or primary TB initially. So now in these cases, you rule out tuberculosis, and in case there is no TB, then you will give them TPT. So TPT is only given, listen carefully, TPT is only given after ruling out tuberculosis in TB positive patients. Very important. In people who were TB infection negative, the latent TB is not there. So if the latent TB is not there, there's no way that the person is going to get an active TB. So nothing needs to be done in this case. These are the existing guidelines, and government has retained these guidelines. So please repeat with me that children whose age is less than 5 years, household contacts of TB cases, or person living with HIV, children living with HIV, you do TPT after you rule out TB using CBNAT. In age more than 5 years, immunosuppressive, silicosis, dialysis, all these cases, you have to do TB infection testing, and then in positive, among the positive, you check them for ruling out TB. So what is the new recommendation, or what is the final thing you need to take down for your exam right now? In all cases of the person living with HIV, beta, if we are talking about the general age, Government of India is recommending that if the age is less than 13 years, either you give 6 months of isoniazid, that is to be given as daily treatment, or you give 3 months of H&P, which is to be given as weekly treatment in cases of less than 13 years. Everybody will get a TPT after you rule out tuberculosis. In case the person living with HIV is more than 13 years, in case the age is more than 13 years, in more than 13 years, that is what is the new recommendation, that we are going to give 1 month of H&P. It is based on the newer evidence from the NEJM 2019 article. And the 1 month of H&P, no dose adjustment is required for dolutegravir. Nothing needs to be done. Simple 1 month of isoniazid with rifampicin has to be given, and this has to be given as daily treatment. Remaining everything is still the same. That is, in special situation like pregnant female, lactating female, the recommended, most commonly, we were already relying on 6 months of isoniazid. Government of India has retained these guidelines. Pregnant lactating, 6 months of isoniazid. Protease inhibitor, female or patient on protease inhibitor, give them isoniazid, 6 months of isoniazid. In contacts with any DRTB, 4R or 6 levofloxacin. Now, this is also important. Many times students get confused that all those people who were already having HIV and TB co-infection. You know that in HIV and TB co-infection, we start with ATT first, that is TB therapy. Then after 2 weeks, in all cases of HIV and in tuberculosis, after 2 weeks, we start them on ART. Only situation is meningeal TB, where you will give a gap of 4 weeks. Now you give them ATT and you finish their ATT and everything. Now, in case, listen carefully, in case the age was less than 13 years and the person already had HIV and TB co-infection, you finish off TB treatment. After finishing TB treatment, you are supposed to give them 6 months of isoniazid again. This is to prevent recurrent TB. And this concept is what we call as secondary prophylaxis. Now, in case the person's age is more than 13 years, he had HIV and he had TB, that same funda, 2 weeks of gap, then you start ART and all these things. Now, in this case, no secondary prophylaxis is recommended by Government of India. They do not need any secondary prophylaxis. Age less than 13 years, give secondary prophylaxis. More than 13 years, no secondary prophylaxis. That is what is the new thing under this new office order under the NTEP May 2024. Regarding the posology, Government of India has retained all the guidelines that in cases of H&P, we are giving isoniazid 300 milligrams, rifampicin 600 milligrams per day. Either we give 2 pills, 300 rifapentin and P plus 300 extra of rifapentin. That will make 600 rifapentin, na? Simple, 2 pills. Or the government of India, in some states, they have given 3 pills where they are giving 2 tablets of rifapentin, 300 plus 1 tablet of isoniazid alag, like separate. So 3 pills, or you give 5 pills and so on. So in cases of interruption, that is also important. It can be MCQ. In case of interruption of TPT, 1 month of HNP, 1 month of HNP in case of interruption, what to do? So now in case of interruption, like if the person has taken more than 80% dosage coverage, what does it mean? 1 month of HNP, they were taking 28 doses now. So if the patient has completed more than 23 doses, if the patient has completed more than 23 doses, then that's okay. Chalta hai, very nice. So you, in case somebody misses 1 or 2 doses, that's okay. Leave that person aside. You just complete the regime and that is it. You do not have to give the missed dose extra, prolong the regime now. Just complete the regime. If you have taken 23, very good, well done. In cases of continuous interruption for more than 10 days or more, in case of continuous interruption of the TPT for more than 10 days, now unfortunately, we need to call that patient as loss to follow up. We need to call that patient as loss to follow up. So when do you say loss to follow up? Can be your MCQ. In cases of intermittent interruption, this has to be continuous interruption to be called as loss to follow up. In case of intermittent interruption, like interruption for 2 days, 3 days, then they take treatment and then they interrupt again, or in less than 7 doses total interruption was there, in these cases you have to give the missed doses. Now give the missed doses and complete the regime within 6 weeks. That is 42 days. You have to complete the regime within 6 weeks or 42 days. Anyways, for your exam, at least remember more than 80% coverage is required for the TPT to be effective. And in cases of continuous interruption of more than 10 days, it is called as loss to follow up. And with that, thank you so much for watching this review update on a newer guideline, revised guideline for management of tuberculosis preventive therapy for PLHIVs. Thank you so much. All the very best and take care.